Okay. All right. Well, I just want to welcome and thank everyone for coming here today. My name is Andrea Vaughn. I'm the WFSE Council 28 Vice President. And thank you for taking the time out of your day. I know some of you are on break, so we'll try to get through this as quick as possible. And also, I wanted to let you know that it will be recorded. As we know, the COVID-19 vaccines have begun to be administered at UW. And this is an important step in helping our country and communities recover from the disastrous effects of the pandemic. However, some of us have concerns and reservations about taking the vaccine, including myself. Our union does not support mandatory administering of the COVID vaccine, but because the risks of COVID-19 are very serious and we're still learning about its long-term effects, we want to make sure our members have the information you need to make an informed decision. With us today are several medical professionals and community leaders who have expertise and personal experience with the vaccine. So I'd like you to join me in welcoming the following folks. If I mispronounce any of your names, I apologize again. So we have Hamid Mohamed, a community leader, Awale Farrah, also a community leader, Ahmed Abdil from the Somali Health Board, Dr. Anisa Ibrahim. We have King County Councilmember Girmay, and I cannot pronounce your last name right now, I apologize. We have SeaTac Councilmember Senayet Negusse, and we have Tukwila Councilmember Cynthia Delostrinos. So with that, I would like to go on to our first question, and the biggest question that we all have. Is the vaccine safe? So I'm going to open the floor to the panelists. Go ahead and proceed with whatever comments and information that you have from either personal experience or the education that you have received.
I think I would like to pass this over to Dr. Anisa Ibrahim as a MD herself. I would love her to give us the thought process, and I'm happy to chime in after that.
Great. Good afternoon, everyone. First and foremost, thank you all for joining. I think as a community, it's really important to answer the questions that communities have about vaccines. I also, just like Andrea was saying, I feel very strongly about communities having the opportunity to make informed decisions about their health. Nothing that I say today is a vaccination campaign. It is truly information so that our community has all of the information that they need to make an informed decision about their health, and that they are given the information that other people have access to, which our communities have often been denied or not made as easily accessible. So that being said, I do, based on the data that I've seen, the data that I've reviewed from both the Pfizer and the Moderna vaccines, which are the two that are currently being offered at the University of Washington and at Harborview, I do believe that both of those are safe and effective vaccines. I think both of those things are important. There is nothing in the safety data that makes me concerned currently. And again, when vaccines are brought out, there are 4 phases of data. It's the initial development, phase 1 and phase 2. Then there's phase 3 when they are actively when volunteers are given either a placebo or they're given the vaccine, and that data is also tracked. So, and the numbers of this were thousands and thousands and thousands of people. So I do believe that we have enough data to show us if this vaccine is 1, safe, and 2, if it's effective. And I do believe that both of those are true. After that, once these vaccines reach the point where they would be under review, I had confidence once I saw that there were 3 independent advisory boards, independent from Pfizer, independent from BioNTech, independent from Moderna, that reviewed reviewed the data, reviewed all of the safety and efficacy data independently. And then all 3 of them came to the conclusion that these were safe and effective. This is just in the United States. The UK did the same thing. Many other countries abroad did the same thing. And I think it's a global effort that actually, and many barriers, including financial barriers that have often been an issue in, pharmaceutics, et cetera. These barriers were removed for the COVID-19 vaccine. So I think that is why we have a safe and effective vaccine that was developed in a shorter period of time than we are used to. Nothing about nothing that's in the vaccine currently is new. I know that many people have been concerned about the fact that it is an mRNA vaccine, but mRNA vaccines in and of themselves have been studied for over a decade, not specifically with COVID-19, but the way in this vaccine is created. So using the mRNA to recognize, to be as a vehicle has been studied as well. And then I think the biggest thing that someone can say about whether or not they believe this, the safety of a vaccine is, did you get it yourself? And yes, I did get the COVID-19 vaccine. I received the Moderna vaccine on January 3rd. I am going to receive my second Moderna vaccine on February, sometime between the 3rd and the 6th. And I think that that is really, really important for a Black, visibly Muslim woman like myself. I do not make recommendations that I would not do myself, ever. That is my oath to who I am as a physician. That is my oath to my community. And if I did not believe in it, I would not be promoting it for anyone else.
Thank you.
Thank
I'd
you.
like to keep it open for other folks as well to speak.
Absolutely. If I may just quickly follow on what Anisa has mentioned, and very much eloquently stated in terms of the efficacy, the safety of the vaccine itself. But one thing I really want to also emphasize is that I don't think any of us in the health field wants to push any particular vaccination or treatment that we know is detrimental to our community. We know that the system has, in many over years, decades, for quite a while, used communities of color and mistreated communities of color when it comes to certain type of experimental drugs and things to that extent. So we are very wary of that. We very much understand, the historical context of that. But at the same time, we also have to be able to give our communities the information that we deem that is necessary, and we believe as healthcare providers that the safety and the efficacy of it has been proven. One thing I want to add to what Dr. Anisa has mentioned is that every vaccine, as a practicing pharmacist, it's one of those things that I quite followed really well in terms of how the process has worked, what stages has gone through. And one of the couple of things that people usually bring up is the fact that it was rushed. And I think a lot of folks don't understand the thought process that goes into an entire vaccine being from the development to the where it goes to the patients. There are multiple phases, and each particular phase has to go a very rigorous process. When the vaccine process started, there were about 33 companies that were actually vying to get the possibility of producing the COVID vaccine. And it came down to now where we only have 2 companies that actually finally produce that, knowing that there are valid, documented process has gone through in each particular phase with that. And I think the independent aspect of not just the manufacturing companies, but also committees that are involved with that and who they are, and communities of color being involved to that extent is also validates the safety of the vaccine. Again, one thing I can add to is what I will tell myself, what I will tell my family, what I'll tell my loved ones, and including myself, whether they should be vaccinated with the COVID vaccine, because we know the impact the coronavirus has had, in particularly with communities of color across the country. We know that over almost 380,000 Americans have lost their lives. We know that on a daily basis, over 4,000 people are dying. So having some sort of protection against it, it is up to us to understand whether it's safe and should we recommend that for our community. Much like Dr. Anisa, I would not be telling folks to go ahead and get something that I know I'm not going to get it myself. So this past weekend, I actually got my first shot of the COVID-19 vaccine. And we are both here talking to you, Dr. Anisa, and myself, and not to emphasize on the fact that we got it, but because I know I'm also going to make sure that my mother gets it. I'm also going to make sure that my relatives to receive it. What if it comes down to the kids as well? I'm going to also make sure that my kids also get it as well when the time is right. So we just want to make sure that folks understand that I will not recommend, and neither would any of our communities of providers who are of color, to recommend something that we don't think it's safe and efficient and effective within our community. So I'm going to leave it at that for the rest of the team.
Thank you for that. And the floor is still open for our panelists.
Councilmember Girmay Zahilay. Go for it. Oh, thank you, Awale. I wasn't going to say anything right now, but I just want to affirm everything that we heard from Ahmed, beautiful remarks, and Dr. Anisa. We graduated from Franklin High School the same year, so I've been knowing her brilliance for a long time. Thank you so much. I agree with what they said. You know, one thing that I want to remind people is your fear is not crazy. Your concern is not crazy. All of these things are very reasonable because there's a long history in our country and in the world of bad outcomes in the medical fields happening to our communities. So your fear, your asking questions, your hesitation, that is all 100% reasonable. And we're here to just make sure that you have all the best information possible. Because something else that's true is that misinformation and lies spread way faster than the truth. You know, if I open up my Facebook, if I open up my Instagram or Twitter, I'm seeing a lot of bad information spreading out there. People are lying and saying the vaccine will turn you into a zombie. People are lying and saying the vaccine will kill you. There's lying and saying that there's this widespread bad reactions to the vaccine. There's not evidence for that right now. There is not evidence. Every single medical professional that I've spoken to, every public health professional that I've spoken to have confirmed for me that the vaccine is safe based on the data and that there have not been wide So as the medical professionals on here will tell you, I'm not a medical professional, there are vaccines for the most part do have some people who have allergic reactions, and that is anticipated. But beyond what is anticipated, there have not been those unanticipated adverse effects. So we want you to make the best decision based on real information, not bad information. And again, I want to affirm you and say that your fear is legitimate, but we're also sharing with you that this is really important to keep our society functioning. Because the other side of this is what happens if we don't get vaccinated. People will lose their jobs. People will die. This virus will grow out of control. Our hospitals will be overwhelmed. And especially you, the frontline workers who are working in the hospitals, you are the heroes of today, and we want to keep you safe. So that's why we're all here for you today.
I'm just going to add one thing. I think I completely agree with everything Councilmember Girmay just said. The other thing that is always in the back of my mind, especially as as the vaccine is rolled out, is that while because of historical issues, right, while the Black communities of color are asking these questions, there are other people who are trying to jump the line and get this vaccine. Now, from day one, right? From day one, it is our communities who have suffered. It is our communities who've had negative outcomes. It is our communities who have died at a disproportionate rate due to institutional and structural racism in the healthcare field. I am going to sugarcoat that. I understand that I'm a medical professional, but it is what it is. And I think a lot about our community because I really want to make sure that we have the adequate information that we need, that we're asking questions, but also that we are not skipped when we are saying, okay, yes, I have decided, or, you know, whatever way. I want to make sure that we are speaking with a voice so that the healthcare systems and everyone is held accountable, so that those doses are there for us to protect us, just like they are there for everyone else. And I think that many times or sometimes when communities have hesitation, it's hesitancy, right? Where we are asking questions and those questions need to be answered. Then it becomes easier for others to kind of push that community aside, which is something I am personally not going to allow, right? We're not going to push the community aside and just keep vaccinating other people as we go down the line, because we know that, you know, if you are Black or if you are Hispanic or if you're a person of color, you're outcomes with COVID-19 at baseline due to social determinants of health are worse. So it's just something that I want to make sure if anyone has questions, if they need questions answered, there are plenty of healthcare professionals and we need to hold those systems accountable. So answering our questions so that they are allowing us to, so that we are allowing the folks that have questions to get all of their questions answered so that they can be protected and they can make an informed decision and not just be pushed off.
Dr. Anisa, can I ask you one question? So for most of us, our idea of a vaccine has traditionally been that a little bit of virus is put inside of you so our body can learn how to respond to that. But an mRNA vaccine does not do that, right? Can you confirm that no COVID-19 goes inside your body as part of this vaccine?
No, yeah, I can confirm that. Let me make sure I'm saying it right. I can confirm that this is an mRNA vaccine. There is no live virus, dead virus, no virus whatsoever that is going into your body at all, which is why if you do see someone who says, I got the vaccine and then I got a COVID-19, then I became infected with COVID-19, that COVID-19 was acquired some other way, because that vaccine does not have COVID-19 in it at all. It essentially, what I would think about the mRNA being able to recognize a spike protein, which is something you're going to hear. And I'm going to say these words in both layman terms and in medical terms, because I want everyone to be able to recognize what people are talking about when they do that. This is how, we have to speak the language of the community and the medical professionals. So what you can look at it is mRNA is a vehicle that goes into your body, which essentially holds up a wanted poster, right? Our immune system is, the way that it learns is it looks at something just like other vaccines, and it learns to look for different viruses or whatever your body needs protection against. So the mRNA is essentially putting up a wanted poster in your immune system so that your immune system can recognize it, can understand what it looks like, and then be ready if it does see the COVID-19 infection at some point. Because it's mRNA, it gets degraded, right? It does not stick around, and there's no COVID-19 in the vaccine whatsoever. So once the immune system has recognized and remembered that wanted poster, the wanted poster goes away because your body knows what it looks like, right? And then your body has protection because it's mounted an immune response, which is sometimes why a day or so after you get the vaccine, sometimes you can have with not major side effects, but expected side effects. Some people have chills, some people have muscle aches, just like with tetanus when your arm is sore. That's your immune system recognizing and remembering that vaccine. And then after that, the wanted poster is no longer needed because your immune system is smart and it will remember that. Ahmed, do you have anything to add?
Dr. Anisa, you explained that really well. I don't think there is much I can add to, except the fact that I think a lot of times one of the questions that comes along in terms of social media and other places that I see is that the current mRNA vaccine process is a new technology. And I think you explained earlier that, with SARS-CoV vaccine process is not something that just came out in 2019 or 2020. We know that both BioNTech and other companies were actually developing protein-based messenger RNA type of vaccines over the years, including the Middle Eastern SARS vaccine and others that didn't take place. But the technology that they gained from and the knowledge that they produced, that process is what led to these companies to expedite the process, right? So it's not something new, but it's something that has been ongoing for quite a while. As Dr. Anisa has mentioned, I think some of the things that folks need to understand is that anything that you take, of course, will have some sort of side effect, right? And so far, the only anaphylactic side effect that we know is people who already have some sort of a reaction to a type of vaccines in their prior history, or some component of the medication. And that's about, from what I can recall, about 4 people who have been vaccinated throughout this whole process, or maybe less. To that extent. But of course, you're going to have an injection site reaction because you got needle going through your arm. That is very much possible. Some people feel, a warmth or temperature spike, something like that. And that goes away, chills. But that beats the entire process. It's much more contained and much less than actually getting COVID. And we know that is for that matter. So the only thing I can add to that is that there's always going to be side effects to a certain extent, whatever you inject your body with. But at this point, knowing the minimal side effects associated with the vaccine definitely outweigh the benefits of getting the vaccine. And that's one thing I really want to take the community members to take from this.
Thank you both for that thorough explanation, and council member for actually posing the question so that we can delve deeper into this. Does anyone else have anything that they would like to say?
Hey, this is Sharonda, WFSE's president. I've been on plenty of these kind of calls as to why I went on ahead and got the vaccine myself to get educated around it. There is a lot of miseducation. I just had a client this morning, African American, who says talked about people getting epilepsy, and I'm sitting there staring at him, and I'm like, do I look like I have epilepsy? But I never did. I didn't tell him I had the virus. But the one thing that I was on the call last night, as I sit on the African American Health Board, as we lost Dr. Dawson, one of her primary focus was to get our people educated. So one of the things that the African American Health Board is going to do is partner with other health boards to get the community, to get the information out to the community. And there will be doctors of color on hand to go into different communities and just offer the vaccine for people who want to take it after being delivered the information that's being talked about today.
Nice.
Thank you, Sharonda, for your input. Also, I would like to let you all know that Sharonda is the president of the local at Harborview. And I think also we have Mike Yastramsky, the president of WFSE Council 28 on the call as well. Whoops, sorry, I was muted. I would like to bring it back to the panelists. Do you all have any other input and any other kind of explanation of why you may have taken the vaccine or why you feel that it's safe for our communities? I think it was brought up that in the past, our communities of color have been used, and I'll just be quite honest and frank, we've been experimented on, and a lot of people have that fear, and that fear was some of that lingering fear that I had kind of went away as I was listening earlier to the explanations of the vaccine and how it's processed and what it's actually doing inside of our bodies. So that thorough explanation in terms that are easy to understand is very appreciated.
Dr. Anisa, one thing that I keep hearing is that halal?
It is 100% halal. There is nothing, there's nothing in there that is a haram. So yeah. And I will say that I won us last week, the guardians of the masjid in Saudi, both got, I've heard that they've all gotten it, but I know the actual guardian of the masjid got his COVID-19 vaccine last week.
And I believe that Islam, if it's a medicine, you're supposed to take it. There's no haram in medicine, even if it's haram.
If it does have, yes. So there's been a lot of discussion about that. At any point, I think the type of gelatin that is used in vaccines is broken down so much to the degree that a collection of scholars, now I don't remember which year it was, Ahmed, but have agreed that it is safe and permissible to use it under Islamic law, essentially. So yes, both answers, yes, but there is nothing that is not halal in the vaccine.
I appreciate that. And I have a couple of questions from the members that are viewing this. Two of the questions are, is it more risky to get the vaccine or to get COVID? And the other question is, what side effects should I expect if I get the vaccine?
It is more risky to get COVID. And I can say that 100%. I cannot stress enough. COVID is something like no other. We see healthy 30-year-olds dying from it. We see healthy 40-year-olds getting strokes from it. We see 80-year-olds suffering with it. And although I think what many people have started to talk about with the misinformation campaign is the COVID survival rate, right? X number of people survive, but it doesn't account for the suffering of communities. It does not account for how much is lost when somebody gets COVID. And sometimes survival in and of itself, from my own personal family experience, means that yes, you survived, but you can't walk 3 city blocks. Right? Quality of life is not taken into these, survival mechanisms. They're not taken. People having significant complications. Yes, they survived, but at what cost, you know? So I can confidently say that the risk that we take with getting a COVID-19 infection is much higher than what I perceive and see from my personal opinion than getting the vaccine.
And to answer the second question, I think much like any other vaccine, I don't think there's anything in particular that we could point out and say this is a side effect that you should be expecting that is much more different than other vaccines. So, you know, as I mentioned earlier, pain in the injection site because you got needle going through your arm, possible swelling. If you take some ibuprofen, things like that will go away. Some people feel, fever or chills the day after. Some tiredness is possible because Dr. Anisa had mentioned early on, as you know, your immune system is responding to what we consider as a foreign object, and there's possible some headache for some people to experience that as well. But again, we couldn't state it any better than Dr. Anisa had mentioned. COVID is a different ballgame. I mean, we've seen how many people have actually died. We've seen how many people have been in incubators. We've seen how many folks are still going through the effects of it once they get better. Loss of appetite is one, some loss of sense of taste or smell. Those are minor things that can linger for a long time, right? So I think when you look at benefit versus risks, to me, and I think any other provider will agree with me on that, is getting vaccinated is much, much easier and better than getting the COVID disease.
And
go ahead.
all of the, I just wanted to say with the side effects and all of the studies, actually both Pfizer and Moderna, but also with the AstraZeneca trials out of the UK, they do, it's important to know that the symptoms kind of come on out of nowhere as your immune system is having this reaction, but they disappear within 24 to 36 hours. Like all of those symptoms improve. Ibuprofen has been very, very helpful. I'm talking about kind of like the fatigue in the muscle aches as your immune system is ramping up, but it is a very short time frame, and many people don't get them at all. So, there is no side effect that anyone can say every single person has experienced.
And these side effects you're talking about are the side effects of taking the vaccination, and as opposed to what are the long-term effects of having COVID?
So we're still learning about COVID, something that I will say. There is nothing that shows, there's no playbook for COVID, as I like to say. And I am not an expert in COVID, but here's what I have learned. Some people will get the virus and they will feel like it's a cold and they'll be fine. Some people will get the virus and be really, really sick, fevers, chills, body aches, muscle aches, difficulty breathing, and that resolves. But there's no, playbook that shows us, will that resolve in 2 weeks? Will that resolve in 2 months? Or will that resolve in, 4 months? There's some people who have gotten COVID back in March who still have respiratory issues. Yes, they're fine. They're out of the hospital, but they used to be marathon runners and now they get winded walking upstairs, right? Though we've seen all of those things. We've also seen that COVID can be a very sneaky disease, in that there have been many people who've gotten COVID and then have had a stroke, right? Who've had blood clots related to COVID. It's very, very different. And I think that this, at least one of the scariest things about COVID, specifically for me, is that there is no predicting how your course will be, right? There is nothing that says, oh, I'm young. And I think we saw this in the springtime or in the summertime when young people were saying, I'm young, I'm 20, I'm 30, I have no comorbidities, I'm just going to go and be fine. And, it probably won't have negative side effects, negative long-term complications. There's nothing that guarantees that. So there's no, there's nothing that Andrea, that I can say, oh, if you get COVID, this is what you're going to have. But it's scary enough to where that's not a ball game that I would want to play. It's not chances that I would want to take.
Thank you. I do have another question. Can any of the panelists describe the process of getting the vaccine and what it was like for you?
I'm happy to say, I don't know if it is already, but
I didn't take the vaccine. I would have answered that.
Yeah. Yeah.
I don't know how I'm waiting for my chance to get it.
Yes. So I will say I work at Harborview. I love Harborview. But this is like one of the most efficient processes I've ever seen at Harborview. So we essentially get an email that says, answer these questions so you can sign up to get your COVID-19 vaccine. I think the system wants to account for, regardless of your decision. Again, these vaccinations are not mandatory, but it wants to account for whether or not that you got the email and can confirm, yes, I want to sign up. No, I decline at this time. So you schedule it. There's a specific time frame that you schedule it for. And for me, I got it after clinic on a Wednesday afternoon. There's a building, you walk in, there's social distancing, you sign up, you sign in, and then they give you the paperwork about and at that time I was getting the Moderna vaccine. They gave me information about the Moderna vaccine and I sat and waited in line. So the nurse could take me back and give me the vaccine. So I was called up, the nurse pulled up the dose, confirmed to me that it was Moderna vaccine. She gave me paperwork that explains, what to expect, what symptoms to not expect, what symptoms that I should stay home for, what symptoms, that I should seek care for, or what symptoms are expected. And then I got the CDC V Safe. I'm not sure if everyone has heard of it, but it is essentially a voluntary system where you can log on and kind of record your symptoms and experience with the COVID-19 vaccine for continued data gathering. This is a great way for, phase 4 trials, continued safety monitoring, for people to continue to get data on the vaccines and evaluate anything that happened. So I got my Moderna vaccine. I got it in my left arm because I'm right-handed and I knew that it was going to be sore. And even when I get my tetanus vaccine, my arm is very, very sore. So I got it, and then I sat out in the lobby where they would want you to wait for 15 minutes if you've never had an adverse vaccine reaction, if you have never had an allergic reaction to a vaccine, or if you don't have allergies or anaphylaxis, you sit there and wait for 15 minutes. And if you have had allergic reactions in the past or have anaphylaxis, you sit and wait for 30 minutes just as the vaccine, just to monitor you after the vaccine has entered your body. So I sat and waited for 15 minutes. I felt totally fine. And then I checked out and I went home.
Thank you. I have a few other questions for you and everyone else. One of them is, how can our members access accurate information about this, and how do they know if the source is trustworthy? That's one reason that I know that we have brought you all together as a panel, because you are all trusted community leaders. So I feel like this is kind of an answer to part of that question. But for folks that don't have access to this or the recording, or just want to give information to their family and friends, could you answer those questions? You or anyone else on the panel? I love how you're explaining everything. You're actually answering a lot of the questions before I can get to them. I really appreciate it.
There's a Facebook page, and it will be coming out. I don't know when it's coming out, Justine. But anyway, today. So there was a blog, and I gave my references as to what steps I took to get educated. And that's what it's going to take for you people to educate themselves on this stuff. So there's a webpage that African-American doctors are doing blogs and giving out information on Facebook. And like I said, the African-American Health Board is gearing up to get into the community. I'd be more than happy to pass that along once I get that information. But as far as my symptoms, when I got mine, was I had hot flashes. For a couple hours, I had hot flashes. And then the next day I did have a sore arm. Athletes who had COVID is showing inflammation around the heart as to why they're passing out. And there was one other thing that I was going to share. Oh, I was going to ask, actually. And after you guys answer Andrea's question, then here's a question I have for you. They're doing research on melatonin and COVID. And they're saying that there's a strong correlation that is helping people to either offset or really, really, really reduce the symptoms of COVID. And I just want to know if you know anything about that research.
So I'd like to pause. Thank you for that question. I'd like to have that question presented to the panel in the members' question section. I have one more question, and then I'll open it up for members to ask panelists questions. Thank you for that question, Sharonda. Actually, I have two more questions. Once people get the vaccine, do they still need to socially distance or wear a mask? And is it safe for people who are pregnant or breastfeeding to receive the vaccine?
Okay. I will try to respond to as many as I can. I think that for effective information, right, depends on what your level. I mean, there's readings galore, right? But I don't expect the general public to read a scientific paper from Pfizer, right? So what else are we depending on? I generally say if you're looking for medical information, the CDC is a great place to start. I will fully acknowledge that things have gotten a little messy there, right, in the current administration. But I do think that they are working very hard to uphold science. Another place that I send, patients, et cetera, to look at is any website that ends in like edu, right? Like, so for Johns Hopkins, they have lots of good stuff. UCSD has lots of good information. They are associated with essentially universities or medical schools or medical centers. So those are good information. The place not to get your information from right now is unfortunately the media, because media is really after clickbait. They are after big flashy headlines that then when you actually open and really read the information, it doesn't match the headline. That can be very, very scary at times. It doesn't actually give you enough information as to, is this true, unrelated? Has this actually been investigated? And the headlines are terrifying. And I look at these all the time, and Ahmed and I have sent them to each other, and we look at them and we're like, there's nothing in here that actually matches this headline. So although I do want you to look at, and be aware of social events and things that are going on right now, I would make sure that I, actually read everything before we look at before you make a decision on a headline, because that's what they're after. They need people to click on things, and they're not going to click on, you're not going to click on so-and-so had a reaction, may or may not be due to COVID vaccine, right? Like, you're not going to click on that. But if there's a flashy headline that says nurse passed out right after getting COVID vaccine, without any context, you're more likely to click on that. So just be wary of that. I think investigative journalism has a huge spot in, bringing out things to the light. So I don't want to say don't follow the media, but I just say ensure that you're actually reading everything. Public health websites, I think somebody put up King County Public Health, the Department of Health websites are also really good sources to look at that. And then someone says, is you providing for that? Also noting that there's info. Yes, info in various languages is very, very important. I know, I am a part of the Somali Health Board, and for a long time we've been, since COVID actually started, we've been having community conversations around COVID in the Somali language. We've been live streaming it to eliminate literacy barriers. I think those are all important things. I think the African American Health Board and the Community Health Board Coalition is also doing very similar things. I've addressed that. What was the other question?
Is the vaccine safe for those that are pregnant and
breastfeeding? Yes. Mm-hmm. So good question. In both the Pfizer and the Moderna vaccine trials, they actually did not recruit pregnant or breastfeeding women that they knew of for the trial specifically. So there's not a lot of data that show that. I can't tell you, yes, the women who were in the trials did fine. That being said, the American College of Obstetricians and Gynecologists have reviewed this, so have scientists, so have many doctors, and they feel like that it is currently safe for both, lactating, breastfeeding women and pregnant women to take. I think they're leaving it a choice, again, because they don't have the number, like the number of people in the study that were pregnant at the time. For breastfeeding women, I have personally been reassured. This is a lot of information, but I am breastfeeding right now, and I did take the vaccine. So I think that openness is important. So I felt that when I looked at the data, the type of vaccines that were here, there's nothing that I found that would be dangerous to my 10-month-old, who I'm still breastfeeding and do plan to continue breastfeeding. I think that there could be passive immunity that I pass on to him, but I did not think that there was any safety concerns that prevented me from taking the vaccine. I have many physician friends who are currently pregnant, anywhere from 23 weeks pregnant to about 38 weeks pregnant, and they've all taken the vaccine after reviewing the data and feeling like it was safe for them.
Thank you for being vulnerable and open and sharing your personal information and experience in this setting. I appreciate that. And I'm sure everyone as well.
And two of the members are raising their hands.
Okay, so I'm gonna open this up for our members to go ahead and ask questions. I think Fasika is first, and then we'll go on to the next member.
And really quick before we transition to that, I just wanted to mention that WFSE is also working on, we have an FAQ flyer with some of the basic information that we've been sharing here today. And I'm going to put a link in the chat to where you can download that flyer. So far, we've gotten it translated into Amharic and Tigrinya. We're working on other languages, and those will be forthcoming as well.
Unmute yourself, Fasika.
Hi guys. Hi Girmay. Hi, how are you? I know this vaccine, but for me, I'm scared. Really, I'm scared. This form inside in the computer is black and white. Something is, why it do that? Is vaccine, is flu vaccine every years? I did. That is no black, white. But this one is really, I'm scared, this vaccine, my decision.
Why is it asking about
I don't know. I have another question. Is 3 people here? I have another question.
I have a question for the doctor, the one that breastfeeding. I don't know her name.
Anisa.
And unmute now.
Anisa.
Did you hear me, you guys?
We can hear you.
Okay.
We can hear you, Fasika.
I have a question for Dr. Anisa. Sorry, I don't. Anisa. Did you take the second vaccine?
When you are breastfeeding.
When you are breastfeeding?
I will be. I just received my first vaccine on January 3rd. I took the Moderna vaccine, so there has to be at least 28 days in between the first and the second dose. So that will be February 3rd, around February 3rd. And yes, I will still be breastfeeding at that time.
I have a friend, she's a breastfeeding, but I take the first one, but I'm waiting for the second. But this, my friend, she don't take it because she's scared. She's
breastfeeding. Yeah, I mean, it's something to be scared of. Our children are our most, like they're our pride and joy, and we worry about them all of the time. I completely understand that. But I did my research. I looked into it. I was, my child only breastfeeds. He does not take any milk, any other milk. He does not take any formula. He only breastfeeds. So he's very dependent on me. So yes, I definitely did my homework before I took the vaccine, because I knew there wasn't a lot of data in breastfeeding women, but I felt that it was safe. So I took my first one, and in February, I'm going to take my second one. And yes, I'll still be breastfeeding at that time.
So when you take the vaccine, did you immediately breastfeed, or you took like a few hours before you breastfeed? Because sometimes they say don't breastfeed immediately. So did you breastfeed?
Well, I mean, I think there was probably an hour in between, but that was just because I was at work and he was at home. So I couldn't have. I will say, just, I don't, just given how the vaccine works, I'm not sure that there should be a time limit between when you take the vaccine and when you don't. I think it's just more important to be very well hydrated as your immune system, starts to mount a response, making sure you're drinking water and your body has the nutrients it needs, so that if you do start to, have a sore arm, that your body's hydrated and you're able to give the baby the milk. But I don't think there's a connection. I think if he was with me, I probably would have breastfed him right then, but I was just at Harborview and he was at home. So I think there was like probably an hour, if that, because I took my vaccine and then I went home. I waited 15 minutes.
Okay, all right.
Other question. When you fill the application for vaccine, why they ask about race? It's a question in my mind. That's why I'm asking.
That's a very
So are you referring to the Harborview UW medicine
Yeah.
vaccine? Right. All right.
Harborview.
So
Yes.
in
Yes.
general, when
The
they,
survey, the survey.
the
that you
survey,
took.
yes.
Yeah, when you do survey.
When you do
Yes.
their survey. Yeah, I think it is mostly data gathering. I think here's the thing with data gathering. Data is two-sided. While I understand you might have a question about why would they want to know what race I am, whether I'm taking this vaccine or not, I think data is important because it helps get the resources where they need to be. Like if there was COVID-19 vaccines available to everyone and I saw that it was only my community that was not taking it, then I would like to see the data to know what can I do to help, right? So although race is definitely a social construct, I think it is important for data and resources because that's kind of what you need to know how the breakdown happens. I'll give you an example that is not related to the vaccine, but it was related to COVID-19. So when COVID-19 first hit, I was on maternity leave, March, April. But within, I think a couple of weeks, both, Ahmed, Dr. Ali and I were asking, where is the language data, right? Because UW would say, we admitted 5, this many people and this many people got this sick and this many people were hospitalized. And we said, well, where's the language data? What languages are these people speaking? What communities are these people from? They need help, they need resources. They didn't have that initially, right? So we advocated to collect that data because then we could say, if you speak a language other than English, you're 3 times more likely to get hospitalized. That is absolutely not okay. Give us funding, give us resources to help, get information to the community. So that is why data is important. So I presume I did not, I was not a part of making this information, but I presume that it is likely to collect the information to know that we are equitably that there's no gaps in the vaccine distribution that we're providing. And at any point, if you don't feel comfortable, you can definitely say, I don't want to say, and then you could move on and you don't have to answer that question. You can definitely, getting the vaccine is not like revealing who you are from a race-based standpoint is not required to get the vaccine.
And I would add to that Harborview or University of Washington is the research hospital, and everything I've ever done, they've always asked age, race, gender, those types of things. And that also helps us with the EDI committee to help us find out where are the weak spots and how can we improve those. So that stuff helps us to be able to help target certain communities that are not being part of the main process.
You guys are asking really great questions. Thank you.
Jessica, do you have more questions? I know you have more questions. Or Masa or Yeshi?
Yeah. She's there too. No, Yeshi. Yeshi, she is coming today.
I think she's on the Zoom. But if you have more questions, I know you have more questions, Jessica, so you can bring it back to the other members. Yes, Yeshi.
Question down there. Somebody's raising their hand. Yes.
That's Yeshi.
This is Zartuhun. This is not Yeshi. But I ask this question because about the race, I'm just keep coming to my mind. That's why. Sorry, guys. Yeah.
So if no one have any more questions, I was wondering if we can circle back to my question about melatonin and COVID.
Yes, we can. Is there any other members that have any other questions? And I know there's several people on the panel that we haven't heard from. So if you would like the opportunity to speak, and then we can have the answer to this other question, or if anyone's heard of any of the research. But I would like to acknowledge everyone else on the panel and provide space and room for you to speak to our members, because as we said, this is going to be recorded and we'd like them to hear from everyone in some aspect.
It is true, and we're here to make sure that, that as you've heard, the doctor and the pharmacists who are just like you, any kind of medication that will harm you. We're here. I would have taken the vaccination if it was offered to me today. We know the historical has been spoken here many times, but it is very important for you to take the vaccination because you are important to the community. You are the frontline worker. You're the one that is keeping us safe. So if you have the chance to take this vaccine to keep yourself safe and your family safe, I would recommend it, because to us, your survival is very important. So therefore, we take time to make sure that we're here to let you know, please help yourself and help us to make sure you take the vaccination.
Thank you. Does anyone else on the panel wish to speak with their input, their observations, any information, any even words of encouragement to our members as they view this? This has been a lot of information, very informative. I know sometimes it can be a little bit overwhelming to get all of this information at once, but it's been amazing information that we've all needed to hear, and I've appreciated and learned from it as well.
Councilmember Senayet has something to say.
Sorry, my internet's a little spotty. Can you hear me? Hi, this is Senayet. So I just wanted to, because some people are, it looks like they're on their phones, so may not see the chat, but I just wanted to direct everyone's attention to King County Public Health's webpage. We've been working really hard to make sure that information is available in a variety of languages and is culturally responsive and provided to our community in a timely manner. That the King County webpage has been translated, the COVID webpage has been translated into 33 languages, and the vaccine webpage is currently available in 17 languages. You're able to find answers to some of the questions that were asked today, and to learn more about the phased approach that Washington State is doing. And then I heard Fasika and her colleagues speaking in Amaringa, so I wanted to say, Ndatfarut ayikutiyak ekalachu, dafrut ayiku. We want to make sure that you guys have access to information, and you should not be scared to ask these questions. It is your right to know. You have control over your bodies and what goes inside them. And it's really important that you are safe and that our communities are safe. We were working very closely with King County Public Health and during the response, and we know that our communities are most impacted. We know that you are the frontline workers who are risking your lives every day. And we want to make sure that you are prioritized in getting the vaccine. And so if you have any questions, please do not hesitate to reach out. In my capacity as a council member, as well as a King County employee, I want to make sure that you have access to accurate and timely information. So please don't hesitate to reach out, and thank you for the service and all the work that you've been providing to our community.
And I'll jump into, this is Cynthia Delostrinos Johnson. I am a council member in the city of Tukwila. I am not a medical professional, so I'm really here in my public capacity. I can say that one of my sisters is a doctor for Kaiser, and she's had both of her doses of the vaccine, and she is doing well, doing fine. And this is something that I really trust, and I'm here to just show that I also trust it. As soon as it's available to me down the line, I will be taking it. I wouldn't recommend it for anybody if I didn't believe it was safe for myself and my family. And I really am here because I do care about all of you, and I care about our community's safety. In Tukwila, we have high rates of COVID in comparison to the rest of the county. And I'm here because I want to make sure that the people in Tukwila have access, as soon as we're able to. And so I'm learning a lot today. I really want to show my appreciation for those that pulled this together, as well as the doctors who are here, because I think their voices really matter. And I will do what I can to make sure that the people in my community have access to the information. So thank you all for the questions that you're posing. I think, we're all fearful of what's new, and we are all seeing news out there and don't know who to trust. But I will take it upon myself to make sure that this information gets out there so that our communities do trust and take the vaccine so that we could all be healthy and safe.
Yeah, I'll jump in as well. My name is Hamdi Mohamed, and I work for King County's Office of Equity and Social Justice, and have been working with public health very closely as COVID started. And when you really look closely at the data and you see the areas that COVID-19 is hitting the hardest, it is South King County. When COVID-19 first started, we were expecting this, right? A number of us on this call was expecting that to happen. Dr. Ahmed, Senayet, and I, and a number of others were talking about that. And what we really saw is that South King County was left out, and was it considered a testing desert for quite some time. Cities like Kent, Auburn, Tukwila, SeaTac, and now places like, SeaTac's Safeway is considered a hotspot, which is a couple of miles away from me. And ultimately, making that, having these testing sites, we pushed really hard to make them available, and it is to protect our community. And so we're really trying to avoid having that same sort of situation now where, people don't get vaccinated and don't have accurate information and really miss out on an opportunity to protect themselves and also to protect their communities, their family members. And so whatever we can do to continue to have these conversations and discussions, I'm so grateful to have our doctors on the line. Dr. Anisa, you've been just a wealth of information that you've provided today. And Dr. Ahmed, it's great. We have to continue to have these conversations, these really, tough conversations, right? Do I, protect myself, or do I lean towards my fears? And, where does this all come from? And we have to continue to do that and ultimately think about our community and our families and figure out ways to, do what we need to do to protect our communities. And when you think about the data too, that was a big part, right? One of the reasons why we weren't able to get some of these testing sites or resources out to areas like South King County is because we were really missing those numbers. And when I did my part testing 2-day drive, we provided language access, translations in over 25 languages. And we were, surveying people that came, and really were able to use that data to push for more resources to come out to South King County. And I know Dr. Ahmed has used that numbers in a number of different places. And so participating in those surveys and sharing that information is really, really important to our communities. And so I just wanted to underscore that. And thank you guys for having the courage to speak up and share your fears with us as well. Thanks.
I just remembered one other question that you asked. I'm so sorry. And the question was, do we still need to wear masks after we get vaccinated? Yes, we need to wear masks. We need to socially distance. The vaccine is not a free pass to travel and do whatever you would like to do. And the reality of that is we need at least 80% of the population vaccinated to make COVID go away, right? So essentially what you're looking for is for many people in the community to have immunity so that it can't bounce from one person to another. If everyone is immune, if everyone has been vaccinated, then COVID has nowhere to go and it goes away. But if only a few are vaccinated, then it will just go to the people who, are not vaccinated. And the reality is, if you have a mixed household where some people are vaccinated, some people are not, just because you get it doesn't mean, the others won't get it. So it's still very, very important. We are quite a ways away from being able to take off our masks and, stop social distancing due to many different unfortunate things that happened in the response to COVID. But until we get at least 80% of our population vaccinated, I don't think we're gonna be at a safe spot to stop masking, especially our community, because like our council members and our representatives have said, while, you know, when people tell me the positive rate is 6% in Seattle, I take that as North Seattle. I take that as around Harborview, Capitol Hill, because I know when it's 6% there, it's 14% in Auburn. I know it's 12.8% in Tukwila, where I live. I know those numbers are not indicative of our people. So I think that's just really important.
Thank you so much. Go ahead.
I have a question for the doctor, and just for my own, since now we have a doctor that who can answer, and wealth of knowledge. If you get vaccinated, can you infect somebody who's not vaccinated?
So that is a little bit harder to know, mostly because if you're vaccinated, we know what the trials have been studying is if you get vaccinated, can COVID-19 infect you? And the answer to that is no, right? Like you cannot get sick from that vaccine. But what the trials have not seen was yet, and we're still continuing to look at, is if you come into contact with it and you don't get sick, can you give that to someone else? And we are thinking no currently, but the data is not as strong, which is why it's really important for the other person to get vaccinated. So even if you came into contact with it and you don't get sick, you're not going to give it to, you know, your kids or your wife or your grandma. So that's why it's still really important to mask up until everyone gets immunity and vaccinated. Yeah, right now the guarantee I think right now the vaccine is 95% effective against getting clinical disease if you were to get into contact with COVID-19, right? And this is like for many other vaccines, you don't know if and when you came into contact with it right now, you know, because I'm vaccinated against measles. I don't know if and when I ever came into contact with measles because I'm vaccinated, which means I've never shown clinical disease, right? So that's what the vaccine is preventing against, and that's the data that we have right now.
Thank you.
And if I might just quickly add, I think the most scary thing about COVID is that there are just so many unknowns that we're just continuously learning as we go. You know, I think early on, I think Sharon, who had a question asked about melatonin and coronavirus treatment. I think when I came across that, I think it was being shared on social media. I had to go back and double check on that myself because, you know, as the disease has progressed since the last 12 months or so, you know, there are a lot of old remedies, a lot of old medications that people are trying. At one point, we even heard about hydroxychloroquine being a big drug out there and so forth. It's nowhere close to that. But melatonin is an over-the-counter item which you can use to, you know, induce sleep. So it produces melatonin in your brain, and that's the same you know, that released when it gets darker at night, so you can fall asleep. You know, I wouldn't encourage people just to start taking melatonin as in a way for treating or at least combating COVID because there's not enough data to support that. There's not enough randomized clinical trials showing that's what it's supposed to do. I think, you know, you run the risk of just putting too much of unnecessary melatonin in your body. I think at this point, the recommendation will be, you know, follow the guidelines, social distancing, masking, you know, hand sanitizing, and of course, getting the vaccine when you're appropriately advised to do so. So I wouldn't recommend people to, you know, start going to the pharmacies and grabbing melatonin and seeing what that will do for them at this point.
I asked the question not because I wanted the answer. I asked the question so the doctors can give an answer because it has been featured on Channel 4. There is a doctor that is following it, and people are trying to substitute melatonin from getting the vaccine. That's why I asked the question. And thank you for your answer.
Mm-hmm. I also put in the chat just a little bit from, you know, what I briefly saw. It was data from the Cleveland Clinic, and this is me. I had not heard about it before you told me, so this is like a very quick search. So it did show that if you took melatonin in this small, I think data set from Cleveland Clinic that there's a decrease in getting COVID-19 vaccine, right? So in the people who took it, there was a decrease. I don't know if that there's an actual causal link, because some things could be true and unrelated, right? Like if I walked outside and it was raining that day, right? Like it didn't rain because I walked outside. Like I walked outside and it started to rain. So I think for me to, for these studies to actually have, like a clinical application, we would need to have either big, robust what they call, like when you're just following studies, like you're just following people and asking them, did you take it? Did you get the COVID-19? Did you get COVID-19? Or there's randomized trials, which are actually the gold standard. When you get people, you recruit them and you say, you take melatonin, you don't take melatonin, you kind of, essentially look at all the other confounding factors, and then you can actually get data to show is the melatonin that's helping or not. And that hasn't been done for melatonin, so I cannot say. From what I know, I would need to search a little bit more, and two, from what I know, it hasn't been done. So then I can't say that melatonin is preventative for treatment at this time.
Thank you all. I have one last question, and then we're going to go ahead and wrap everything up. The question is, if you have already had COVID, should you take the COVID vaccination?
Yes, you should, because we have seen that people can get reinfected with COVID. Again, it is one of I've never seen a virus as well, maybe I have, but COVID is not a nice virus, and it kind of does whatever it wants. So there have been people who have gotten infected 2 or more times with COVID. So I will say that, and they don't know exactly why that is, but they know that for one reason or another, their immunity waned after they had the initial infection, and then they got reinfected. And we've seen that enough times now where we are recommending, even if you have gotten COVID, once you recover, you should get your COVID-19 vaccine. Because again, this vaccine is showing about 95% immunity, and you might not get that from just having the COVID-19 infection itself.
And Doc, one more question. I'm sorry, Andrea, but there's another popular question. The new variant of COVID, is the vaccine going to tackle that?
There's not a lot of studies. I think we are just now learning about these new variants, but from small studies that people have seen, specifically to the UK variant, they feel that the COVID-19 vaccine is going to be effective against that UK variant that they've seen. But now, there's other variants that are popping up now. So I think that story is still, developing. So we'll know a little bit more soon, I hope.
And did we have one more member question as well, Yasmin?
I will try to give Yeshi opportunity to ask question. Yeshi, if you have any question, go ahead. Unmute yourself. It looks like she froze. No, there you go.
You're still on mute. Unmute yourself. There you go.
Okay. I have a question, but mostly they answered it. So just one question. Is that possible to get a COVID after you get vaccines?
So is it possible to get the COVID infection after you've gotten the vaccine? Yes. But after so nothing man-made is 100% ever, right? But we know that once you've gotten 2 COVID-19 vaccines, you are 95% effective. You are 95% protected from COVID, right? From the COVID infection, which is essentially up to par with many of these other, it's actually a little bit even more, Ahmed, correct me if I'm wrong, from many of these other vaccines that we've received, including polio, MMR. It's right up there with those other vaccines. So the protection is really, really good. The thing is, well, yes, 95% effective. So the question is, you know, I think on social media, you'll see that there are many people who might have gotten the first dose of their COVID-19 vaccine, which means they're not yet 95% protected. And then they'll come into contact with COVID, and then they might get the COVID-19 infection. And that's probably because their body hasn't built up enough immunity. That's probably because they probably contracted the COVID-19 vaccine and they're seeing symptoms now after, because this virus can remain dormant, right? Anywhere from 2 to 10 days after you get it. So yes, there is still a chance, but if you get the vaccine, both doses, then there's a 95% decrease, right? So there's a still small chance that you might get it, but overall that it's 95% effective. So it significantly decreases your chance of getting it.
Thank you. And because it's too many people, they scared to take a vaccine.
Yes.
So that's a good information you guys give it to us today. So we're so happy about it. So guys, thank you. Thank you so much. We guys having you all those great doctors. And then we got all informations.
Thank you. Good.
So
Thank you for
so
answering,
much.
you know, for asking questions. It's really important. And I think it's important to know it's important to know the information in which we make our medical decisions. And it's important to know that you have power in asking for, you know, your elected officials, your doctors, your nurses. You have power in asking for the information that you rightly deserve. And you know, with this vaccine effectiveness, I think it's really, really good, right? Like it is, like I was saying, up there with, you know, the measles vaccine, the polio vaccine. We don't see polio anymore because the vaccine is so effective, and the effectiveness of this vaccine is up there.
Yeah, Anisa, just to add real quickly in terms of you know, the thought process that some people might get the COVID after getting the initial vaccine is similar to what I usually hear when people get flu vaccines, right? It takes some time for your body to build the immune system to protect you. Because sometimes you hear people that will tell you, hey, I got the flu shot and then I got sick. You didn't actually get sickness from the flu shot. You were actually exposed to the virus, the flu itself, before your body could protect you fully. So it's similar to that thought process. You know, you have to get the first shot, and then, you know, depending on which one it's Moderna or the Pfizer, 21 days to 28 days, you have to get that another vaccine as well, and that protects you up to 95%, which is far greater than a lot of the vaccines that are out there that we are very much familiar with, right? And a lot of times, you know, I think from my community, a lot of times what I tell them is the same thing that, you know, when people are either going to Hajj and they're getting vaccinated, because, you know, when you get there, there's a likelihood you might get meningitis, so you have to protect yourself from that disease. So it's good you guys are asking wonderful questions. I'm hoping that, you know, we're able to answer that, and I'm really appreciate the fact that we have got our elected officials and our representative from the county who are here, and great questions. I appreciate everyone for being here.
Thank you, everyone.
Thank you.
Want to wrap this up with a resounding thank you and applause for everyone's participation. Like you just said, we're grateful for our elected officials. We're grateful for our community representatives. We're grateful for our WFSE leadership. We have our WFSE president, Mike Yastramski, was quietly observing and just taking it all in as well. This has been really informative. I hope that our recording is available to all of our members, because all of this information is so vital. We all need to hear this, because I know for myself, I learned a lot today. So I want to thank you all, and I want to send you health and happiness. Also let you know if you have questions or need assistance, you can contact our Member Connection Center, the MCC at mcc@wfse.org, or the 1-800 number is 1-833-622-9373. And also reach out to your shop stewards and your other union siblings if you have any questions or concerns, as well as your community leaders and your elected officials, because they do care, as we've seen today. So thank you all, and have a wonderful rest of your day.
Thank you, guys.
Thank you so much, everybody.
Thank you so much, everyone.
Thank you. Bye.
Bye.